Today I am going to show you the demonstration of how to assemble the organ cylinder, regulator and tube connection. Okay, this is very important for our APC diathermy. Okay, if you take our APC diathermy, these are the three important components. In this gas, we filter organ gas. The organ gas is higher purity. When you are refilling, you have to do organ gas refilling medical grade, which is 99.99, at least 99.99%. Okay, that much of purity only you have to use in this organ cylinder because it is directly used to the patient. So always suggest that organ gas should be in higher purity. Okay, don't use the normal organ gases which is used in industrial purpose. Okay, always use a medical grade organ gas. And then we have a tube and we have a regulator. This one I am going to demonstrate how to assemble this. See, this is the regulator which is supplying along with this APC machine. So in this regulator there are 2 meters. You can see this. 1 meter will show you the cylinder pressure, like cylinder capacity, how much gas is there. In this meter it will show. Okay, and this is the meter it will show like what is the output power, like output gas pressure, how much we need, that we can tune here. So for this only this meter. So if you take this meter, you can see this higher value will be the capacity of the cylinder, and this lower meter is the output pressure which is going to set by us. Okay, so this regulator is already tuned in such a way with we already set it in such a way 3 m bar. This is the standard pressure which we recommended to use in our Excel diathermy. Okay, now I am going to show the demonstration of this assembling. So when you take this tag, you can see here, this is the tube. There are 2 ends. One is machine end, this is the machine end, and this is regulator end. So in this regulator end, you have to thread it over here. Okay, if it is a new regulator, there is no need of Teflon. But if you are regularly using, if your thread is not good means, then you have to use a Teflon tape and then you have to fix. Okay, once you tighten it, then you can use a like adjustable spanner. You can tighten it. Okay, don't over tight because thread may get damaged. Okay, tighten it. That's all. So now the tube is acted with the regulator. Next part I am going to assemble it over the regulator. This is the movable part. In this only thread will be there. So what you have to do, just hold it, keep inside, straight away. Don't do it in inclined position. You are supposed to be keep it in a straight position. Okay, then tighten it. Okay, you have to make full thread inside. Now you can see this threading is going on inside. Okay, once it is over the hand tight, then you can use an adjustable spanner. You can tighten it more. Okay, because tightening is very important. All the places, if you are not tightening properly, automatically gas will get leaked. At the moment, end of the day, before surgery itself, the cylinder will get empty. Okay, I am doing it hand tight. That is enough. You are not supposed to do over thread because if you are doing over thread, automatically thread will get damaged. Okay, so now regulator is connected, tube is ready. So when you are keeping the trolley, you should remember it should be in horizontal position. If you are keeping it like this, sometimes it may fall down. So during the trolley, you have to keep it in horizontal position in the trolley tray. Okay, like this, and regulator to be safely placed. That is very important. Okay, so now I am going to demonstrate here. So once you set up, then you have to open the knob. Here it is showing, see that it is opened. It is showing the direction of this side. Okay, you can clearly see this direction is mentioned in such a way, open to be this direction. So I am just opening it. Don't worry whether it is getting leak or not, because you can see once I open, you can instantly see the meter reading. There are 2 readings. One is bar and another one is PSI. PSI in the sense like there are 2 units for the gas pressure. Here you can see 150 PSI. If it is 140 to 150 PSI, understand this cylinder is full. If the cylinder capacity is getting low, you can see the reading will be slowly getting reduced to 100, 80, 40. If cylinder capacity is going to below 40, it is advisable to have another cylinder. Okay, that is very important while using APC procedures. And this is the meter, as I already told. Here also there are 2 readings. One is PSI, another one is M bar. So PSI, you can see here this black reading. No, you can see black is bar and PSI is red. Okay, so here also black is bar, red is PSI. So we are going to set, as I said earlier, it is the pressure to be maintained as 3 bar. So here you can see 0, 1, 2 and 3. Okay, So now we already this tube this regulator is adjusted in such a way as 3 bar. So you no need to adjust anything in this regulator. Just simply open the cylinder. You have to connect in the machine. So in order to check the this adapter, we need to press this plastic part. No, you can see closely. You can see this. Just press this button. You can feel that gas is getting leaked over here. Okay, this is a very important section. That is very important to avoid the gas leakage section, because now it is not leaking. So once you press inside the machine, automatically the gas will connected with the internal circuit of the diathermy. Okay, at the moment automatically you can see. So whenever you pressing, the pressure reading should be like, you can see it is going to 3 to 2.5. that's all. It is not going to less than 2 or less than 1 means automatically machine will give an error of low pressure. Even if you set more than 3, then automatically you will give an error of high pressure error. So high PRS something it will show in the display. So this is all the very important factor. So always one more thing I want to tell you, this O-ring is very important. So many cases, if you are not pressing the knob, if you take out instantly, automatically this O-ring will get damaged. Okay, at the moment you need to change the O-ring and you have to fix it. Okay, thank you. So after assembling, once the surgery was over, or you want to change the cylinder, or you want to remove the entire thing, means you have to dismantle it. The thing is, again in the machine back side, press this button and you have to take out this tube. Once you take out the tube, you can see this, the readings are full. Then it means that this gas pressure is not closed here. So what you have to do, just in opposite to open direction, you just rotate this knob. So automatically cylinder will be closed. So after cylinder closing also, you can see this, some pressure is in the tube in between the regulator, and that's the reason meter is showing some reading. See here, still the meter is showing reading, because even though I am closing this cylinder, still the meter is showing the reading, because the pressure is inside the tube in the regulator. So what you have to do, as I said, press this white knob. Now you can see this reading is getting slowly come down. So you have to press slowly with the nail, so all the gases will come out. So at the moment it is very easy to remove. If you are not releasing the air, to unscrew this screw is very difficult at the time. So that also very important. Always reduce all the gases and then you have to unscrew it. Okay. So same way tightening, I am just screwing it, that's all. So after unscrew like that, you can remove and you can keep it in a tray or wherever you want. Okay, keep it safe, because these regulators are glass, plastics are there, so it may break. Okay, thank you.